the past, care has developed within a series of silos, with consultants dealing with a very specific set of diseases like diabetes or dementia or heart trouble, and people have been treated as if they've only got that one disease. However, now the majority of people over the age of 75 have at least 3 of those long-term conditions, which means they need to be treated as a whole person rather than a series of individuals. So a series of individual diseases. So what that means is that we're asking lots of people who are used to operating and working independently, now working together in an integrated form. And that's what today's about.
So the good practice is that we have a common sense of what we need to do together. So we're not fully integrated, but we're aligning what we're doing. We're creating multidisciplinary approaches, particularly looking at health and social care staff. So bringing together community health services, mental health and social care staff to work to take a place-based approach to how we deliver care. So that's one of the good things, I would say.
On the issue of culture with our health and social care services, I mean, one way we've tried to tackle it right at the beginning was we had quite a big workshop where we invited people across health and social care, and we talked about the importance of what we're trying to do to try and get that shared vision, you know, so that we've all bought into the same vision for what we're trying to achieve. And the difference we're trying to make. And the way we did that was to look at some key statements and what people thought about those key statements and whether they agreed or they didn't. And we found that there was quite a lot of commonality in that vision for trying to get people discharged as quickly as possible, because there are real benefits for people in terms of their recovery and their longer term health and well-being. So that brought people together. But also within that workshop, what we did was we had people sit at tables for their own organisations. So we had the acute trust, social care, the voluntary sector, community health, each sitting at their own table, and people circulated around them and heard about what their priorities were around what we're looking to do to integrate health and social care to try and work on these issues. And that enabled people to really hear what are the issues for you, for your organisation, and how are they different to my issues from my organisation. And we got that to try and get this shared understanding of the cultural differences. And that combined with, we'd also done a programme where we were trying to develop anyway integration change champions, and part of that was, again, we did some workshops around exploring cultural differences across organisations, and what often came up were actually some of those differences are more about perception rather than reality, and actually at the bare bones of stuff there are a huge numbers of similarities across all our organisations, and sometimes it's just around the processes being different, and that's something I think we can work with a lot more.